What are some of the benefits of being a member of your local NSSLHA chapter?
Well, a few of them I've mentioned already, but you also get subscriptions for the same journals that a professional would get subscriptions to. You get discounts on your certification when you graduate through ASHA. You can attend our national conventions. You can volunteer at the national convention. You can get a discount to attend if you don't want to volunteer.
Yeah.
But I would say that the biggest benefit that I see with our chapter is that we have a community here that's embraced our NSSLHA students, and they have provided research opportunities, volunteer opportunities. There is a lot of networking that goes on.
Mm-hmm.
In the last few years, our NSSLHA officers have attended ASHA, which gives you a understanding of the field, what you're really getting into, and helps you network before you graduate.
Right. I love that. But it's not a requirement as a graduate student. Even if your university does have a NSSLHA program, it's not a requirement to join NSSLHA. But I think it would be a huge benefit to you to join that because, like you said, I think primarily just the networking and being able to meet people and get out there and the outreach and the volunteer work. You talked a little bit about starting your local chapter. How hard is it to do that? Is it hard? Would it be a daunting task for someone who's listening and maybe their university doesn't have a local chapter? Is that something that they should look at and be like, oh, that's going to be a lot of work? And how many members do you have to have an official NSSLHA chapter? Is there a number to that?
As far as I know, there is not a number to that. You do have to have officers in place. And I would say the first step would be to download the toolkit to see what you need to start a chapter.
Yeah.
And then I would check with your faculty advisor, see if you can find an advisor who is an ASHA certified speech language pathologist, because that is also a requirement of an advisor that can help guide you through the structure piece. Because if your university doesn't have a registered student organization office that can assist them in organizing the structure, there is a bank account that needs to be opened. There is a structure of needing bylaws and rules basically for your chapter. So aside from the toolkit that NSSLHA provides, the national NSSLHA, you also need to abide by your university's rules.
It doesn't sound like it would be too difficult. So if you're not a member of your local NSSLHA chapter at your university, join it. There are huge benefits to it, just meeting people, getting out into the community. But also, if you don't have one, I did not know that there was a toolkit. So you can download it, and then you can be one of the founders of your university's NSSLHA chapter. That's great.
Absolutely.
Yeah, that's great. All right, let's move into internships. I know that a lot of SLPs, I recently joined a Facebook page for SLP clinical fellows. And I just recorded the podcast. It was a question and answer. So I've been going through the Facebook page and I'm getting so many questions, or there are so many questions posted about the clinical fellowship year and internships and those kinds of things. So let's talk about an internship. When will graduate students start doing their internships?
So every program's a little different. Some programs do not have an on-campus clinic. We do have an on-campus clinic, and through that clinic, we serve about 1,000 patients in a year. So our students actually treat patients in their second semester of graduate school and they go out for internships in their final year. So anywhere within that final year, you'll go out at least to 2 separate locations. Community sites. However, there are a lot more opportunities that may happen a little earlier that are overseen by UCF faculty. If you don't have a clinic in your university, maybe you have a university that has an online program, you would be Some programs require the students to be responsible for finding their own internships, which I think that does cause a little bit of confusion and stress to the student. But it can be done, and we can give you some tips today. And the other is if you are in a smaller area, every university is going to have a coordinator, someone within the faculty, whether it's an advisor or a coordinator like myself, would assist you in at least navigating where to look, who to ask, and how to ask them.
How do you go about preparing? It's been so long since we've done internships, and I remember the stress of that. How would you talk to students about preparing for that internship? Because there are so many different areas. You've got your voice, you've got, medical setting, you've got a school setting, you got private practice, early intervention. How do you sit down with all of your graduate students and just find out what their interests are? Or is it a form that they're filling out now? How do you go about even placing these students?
But we have a survey that we send out to all the students to find out what their interest areas are. But we also make it abundantly clear that the requirements of our accreditation is to give students experience across the lifespan in every area of the Big Nine.
Mm-hmm.
And the Big Nine areas, you mentioned a few of those, but we have to give them the breadth of experience that they require. So if they have an interest area, that's wonderful, but that doesn't necessarily mean
that's where you're going to get.
Exactly. And you also need to remember, students need to remember that if that's your interest area, that may be some of your internship, but no one can guarantee who's walking through the door unless you're a specialty clinic.
Right.
So if you're really interested in dysphagia and you get a client who's had a stroke, it's not likely that they only have dysphagia, and it may not be, they might not even have dysphagia. They might have a language disorder you need to work on, or dysarthria. So students need to be ready to embrace whatever comes their way and know that they're prepared for it. It is difficult to transition from a book to practice.
Mm-hmm.
And it's difficult for everyone. So if you feel uncomfortable, sit in that and grow.
Right. And you're not alone. I remember just not even knowing what I didn't know. They're like, "Do you have questions?" And I'm like, I'm sure I have questions, but I don't even really know what those questions would be, just being so overwhelmed. And it's highly competitive, right? So I would think that with a program as large as UCF's and even other programs across the country, it's competitive. And Orlando is a big area, so you've got lots of different places to pull from to place these students. But if you're in a smaller rural area, you don't have as many opportunities, I would think, without having to travel.